Narrator begins, warm and friendly tone, asterisk. Hey everyone, and welcome back to LumaWell. Today, we're diving deep into a topic that's generating a lot of buzz, especially for those navigating the challenges of type 2 diabetes, intermittent fasting. Forget fleeting diet trends. We're talking real science and groundbreaking research. For years, type 2 diabetes management has largely revolved around medication, diet, and exercise, a complex balancing act for many. But what if there was another powerful tool in the toolbox? That's where intermittent fasting enters the scene. It's not just about what you eat, but when you eat. Sounds simple, right? But the science behind it is anything but. Now, let's rewind a bit and understand why this is so exciting. Type 2 diabetes is, at its core, a story of insulin resistance. Your body isn't responding effectively to insulin, the hormone that unlocks your cells to let glucose, sugar, in for energy. This leads to elevated blood sugar levels, the hallmark of the disease. Recent studies have been focusing intently on how intermittent fasting affects this delicate metabolic dance. And the results? Well, they're pretty compelling. Think of intermittent fasting as giving your body a regular, reset button. During fasting periods, your insulin levels naturally drop. This allows your cells to become more sensitive to insulin when you do eat, potentially reversing that insulin resistance that's at the heart of type 2 diabetes. One particularly fascinating piece of research looked at individuals with type 2 diabetes who incorporated intermittent fasting into their lifestyle. What they found was significant: improved blood sugar control, reduced reliance on medication in some cases, and even weight loss, which further contributes to better insulin sensitivity. We're talking about potentially transforming how people manage their condition, moving beyond just managing symptoms to addressing the root cause. But, and this is a crucial, but intermittent fasting isn't a one-size-fits-all solution. The studies also highlight the importance of personalized approaches. Different people respond differently to various fasting protocols, like the 16/8 method, fasting for 16 hours, eating within an 8-hour window, or the 5-2 approach, eating normally for 5 days and restricting calories for 2. What's more, and this is really important, if you have type 2 diabetes and are considering intermittent fasting, you absolutely must consult with your doctor or a registered dietitian first. This is non-negotiable. They can help you determine if it's a safe and appropriate strategy for you, especially if you're already taking medication to manage your blood sugar. Close medical supervision is essential to avoid potential complications like hypoglycemia or dangerously low blood sugar. Think of it this way: intermittent fasting can be a powerful tool, but it's a tool that needs to be wielded with knowledge and care. The latest research is undeniably promising, offering hope for a more proactive and personalized approach to managing type 2 diabetes. It's about empowering individuals to take control of their health, armed with the latest science and the guidance of qualified professionals. So, stay informed, stay curious, and always prioritize your well-being. And of course, keep checking back here at LumaWell for more insights on health and wellness.